So it's really important that your TCO and your business manager work really closely together, because although your business manager is setting the marketing and looking at the diaries, actually I then delegate to my TCO. So I won't ring the patient and ask whether they want to come back for an appointment. I will make sure that my TCO does that. I also, my TCO will come in and have a weekly meeting with me on a Monday, and we'll look at the diaries for the week. We'll look at, I'll look at the inquiries that she's had. So with marketing, the inquiries will come in, I oversee the inquiries, but they come into the TCO and she's responsible for answering them, for WhatsApping them or calling them. And so I will look at what she's been doing in the week. Has she called these patients back? What sort of, say, hit rate she's had from the inquiries overnight. If we've got 10 inquiries, how many has she booked in? And I will be looking at how much money she's making out of each room, when she's booking the patient in, what sort of high value patients she's booking in. Is she following up patients from maybe a month ago? Or with the open evenings, it's really important that once they've been in for treatment or for a consultation, she then follows up with that. And so my open evening from September, we're still following up for patients now who've seen the implantologist, but maybe haven't made a decision because it's a £20,000 treatment plan. And because the marketing, we have such a high spend on our marketing, say £10,000 to £12,000 a month, it's really important that those leads don't go missing, or when you've had those patients in. And the TCO's role, as we've described in our other video, is really about following up those leads. But my job as a business manager is to make sure that the practice is making money. And so really following up with my TCO, making sure that she's following those leads, making sure she's on brand, making sure she's looking at the diaries and working with those dentists as well. So it's quite simple. We have a bonus structure for all our staff, but for the TCO, I give her a £20 bonus for an Invisalign or an implant that she books in, but it's on a fair use policy. Obviously, if I've got a client ring up and say, oh, I want to book in for an implant, she doesn't get a bonus for that because that's quite easy to book in. Or if it's just a case of somebody emailing in and she's replied and she's booked them in. It's for those patients that she's had to follow through on a journey and work hard to get them booked in. So she will give me a list of those patients that she feels that she's worked hard to get booked in, or she's had to go out of the way to book in, and I will go through those with her every month. I will look at the case management system, I'll look at our patient management system, and all the notes are on there, and then she will have a bonus based on that. She then has an annual bonus that we have a pot of money, and I give that out to staff based on a review process. So I do a review for all the staff, but those staff who are in management positions, obviously they will achieve a higher bonus level than the staff who aren't in a management position, because as I said, it's really important to engage your staff. If you want to grow your business, you want those staff to be helping you to do that, and you can't ask them to do that for free. They've got to know there's something in them for them. All staff really want to know is when they come to work, what's in this for me? They don't do it for free. They're not coming to do this because they like you. They're doing it because there's something in it for you. And if you're ended up giving a nurse who's paid £12, £13 an hour, £1,000 bonus once a year, you're really asking them, engaging them in your business, and that's really important. So although it might seem like a huge outlay, the benefits eventually will definitely outweigh the negatives of spending that money.